Hello, everyone. Thank you so much for joining me today to discuss hepatitis B and liver cancer, a silent global crisis. So, just before we begin the presentation, a little bit about myself. My name is Sreenidhi, Maddineedi, and I'm a rising senior here in James Logan High School in Union City, California. Talking about some of my personal pursuits, I'm a cancer researcher, and this summer had the incredible honor of being named a Simons Fellow at Stony Brook University. And I recently published with Harvard University faculty members on a meta-analysis of the mTOR complexes and their role in oncogenesis and metastasis. I'm also a rare disease legislative advocate and president of a local nonprofit organization, as well as an active student and volunteer photographer. So, a brief overview of today's discussion. We're going to start off talking about the background of hepatitis B and liver cancer, then move on to discussion of the two of them in tandem, talking about some of the popular treatment and prevention strategies, then wrapping up with a discussion of some of the challenges, barriers, and access to care, and then key takeaways and a call to action. So, first of all, why should I care about hepatitis B? Well, Hep B is a major global health crisis and causes liver infection in nearly 254 million people worldwide, with an estimated 1.1 million deaths each year, largely owing to cirrhosis, which is a scarring of the liver tissue, and liver cancer, which is actually the third leading cause of cancer death globally. The WHO, or the World Health Organization, has actually identified their highest burden of disease to be in the African and Western Pacific regions, and they have made eliminating hepatitis B a key target of their global health agenda. So, what exactly is Hep B? Well, Hep B is a highly infectious viral infection that is caused by the HBV virus and targets the liver, ultimately leading to inflammation, the scarring or cirrhosis we just talked about, liver failure, and liver cancer. In just the US alone, nearly 2.4 million Americans are infected with chronic Hep B. However, only 25% of those who actually have chronic Hep B are diagnosed. And we see every single year new liver cancer cases and deaths that are just rising by the thousands. And we do also see disparities here in the US, with oftentimes foreign-born individuals or those being of Asian, Pacific Islander, or African descent being generally disproportionately affected. And we see those same disparities sort of exist on a global scale too, where 80% of the global burden is oftentimes concentrated in just those 10 countries. And we also see marginalized groups such as indigenous populations, migrants, and refugees, again, being disproportionately affected. We do again see the highest burden of disease tending to be in the sub-Saharan African and Eastern Asia regions, where nearly 1 in every 10 people actually lives with chronic Hep B. So, first, understanding hepatitis B. Well, Hep B infection can be acute, where it's short term, or chronic, lifelong. But in both cases, oftentimes individuals will show no symptoms at all, making early detection very difficult. We do have some transmission routes, especially mother to child transmission during birth or perinatal transmission, that oftentimes increases the risk for contracting the hepatitis B. And in fact, nearly 95% of infants who actually contract Hep B at birth will go on to develop chronic hepatitis B, whereas it's less than 5% of adults who do. And talking more so about the difference between the two, it's oftentimes adults who will contract the acute or short-term hepatitis B and they'll make a full recovery, whereas children or infants tend to contract chronic hepatitis B, which will last way more than 6 months, oftentimes lifelong, and can ultimately lead to cirrhosis, liver failure, or even liver cancer. Now, how exactly Hep B leads to liver cancer? Well, Hep B causes this sort of ongoing liver inflammation, and that leads to repeated cycles of the cell damage and regeneration, which can cause genomic instability. And that sort of back and forth is what causes the hepatocellular carcinoma, or sort of this oncogenesis of the liver cancer. And just again, by the numbers, we see nearly 254 million people worldwide living with Hep B, which is also responsible for 39% of all global primary liver cancer cases, which, if you'll remember from the beginning of the presentation, is the third leading cause of cancer death worldwide. So again, Hep B patients are oftentimes asymptomatic. However, early detection being so key, we've recently had a lot of advancements in blood tests, which can identify sometimes now the active infection of the hepatitis B or even the amount of virus that's actually in the blood. And physicians, when they do have the resources, will oftentimes order further imaging just to really assess the liver damage, both in terms of Hep B and liver cancer. Now, Hep B in 1982 actually had an incredibly safe and highly effective vaccine come along. And since then, over 1 billion doses have been administered globally, and seroprotection actually exceeds 95% in healthy individuals after their full vaccination series. And what's rather fascinating about the hepatitis B vaccine is that even without any boosters, in immunocompetent individuals, immunity can last for nearly 20 years, if not more. And there's several success stories for hepatitis B. I chose to focus specifically on Taiwan and Italy. Italy, actually, where since its universal vaccination began in 1991, we've seen a nearly 92% overall decrease in the incidence of acute hepatitis B in the entire population. And on a global scale, over 190 countries as of 2024 have actually introduced hepatitis B into the national immunization schedules. And this has been estimated to have averted nearly 210 million new hepatitis B virus infections since just the year 2000. And there's several different types of treatments that are currently on the market, some of which are prescribed more often than others just because of a fewer or not as severe side effects. However, there are continuous research and new developments that are being made into gene editing approaches, more therapeutic vaccinations, and even those which can completely cure the disease and sort of rid the entire surface antigen from the body entirely. Now, what is interesting, however, is that we have two organizations, the World Health Assembly and the World Health Organization, the WHO, which sort of united forces back in 2016 to create these sort of goals by 2030 for the elimination of hepatitis B and C. We want to see nearly a 90% reduction in new infections and a 65% reduction in deaths. And there are several different strategies that we have developed over the years to sort of meet these goals. However, unfortunately, nearly 86% of those who are actually with hepatitis B, chronic HBV, are still unaware of their infection, and 97% have not been treated. And that's largely because of the insufficient funding and obviously the stress that COVID-19 recently had on our healthcare systems with the recent pandemic. And of course, inequitable access, especially in those low and middle income regions, in terms of access to care. So there is slow progress that's unfortunately being made to meeting those 2030 elimination goals, and it may not happen without urgent acceleration and investment from all scales. So we must really choose to embrace our role in ending hepatitis B. We need to advocate for universal birth dose vaccination, support awareness campaigns, promote routine screening, especially in these high risk and marginalized populations, and really push for more global collaboration and targeted investment. This is really essential to reaching the WHO goal of eliminating hepatitis B by 2030. And if we push for more increased funding to expand access to affordable care, research, and even treatment, it can lead ultimately to even the discovery of a permanent cure and improved therapies. Now, I'd like to wrap this up with a final call to action. Remember, hepatitis B might be silent and deadly virus, but it is preventable because of safe and effective vaccinations. Chronic infections are, of course, most dangerous, but with early detection, education, and access to care, this is all critical to saving lives. And with global effort and commitment, we can ultimately eliminate hepatitis B. Now, I cannot end this presentation without thanking the Johns Hopkins University GHLC team for not only accepting me into this conference, but giving me the chance to present my work with all of you. And from the depths of my heart, a sincere thanks to the countless researchers who are doing various studies and surveys, the physicians who are treating those who have hepatitis B and liver cancer, and of course, the global health professionals who are working to raise awareness of hepatitis B. So here are some of my references if you're interested in checking them out. And of course, remember that together we can all end hepatitis B, this true silent global crisis. Thank you again so much for joining me today. If you have any questions, please feel free to reach out. Thank you so much, everyone. Goodbye.